welcome back. I'm Mabel Jong, and I'm here to talk with Kevin Pereau, founder and CEO of TranscendIT Health, but also the author of The Digital Health Revolution. Kevin Pereau, thanks so much for your time. So this book took about 1.5 years to write.
It did.
And what's it about, and what do you hope to leave people with?
You know, it's really the story of how our smartphones are changing the way normal people manage their health. I've been in digital health for about the last 8 years, and I was driven to write the book through a personal experience. I'm from a tiny village up in upstate Vermont. We like to joke that there are still more cows than people in the town that I grew up in, and I reconnected with a couple of schoolmates who confided in me that they now have type 2 diabetes. And I asked my friends, what are you using? What tools are you using to help you manage your condition? And they both just laughed and said, nobody cares about us. We did this to ourselves. This is type 2 diabetes. And I thought, wow, that's just, shocking, right? I mean, I've been in the industry for 8 years and I've seen so much innovation, and I thought it's heartbreaking to think that people who need these tools don't know about them. So I did what any friend would do. I went on Amazon and I started looking for some consumer-friendly things that I could buy for my friends, and I was shocked there really wasn't anything. I reached out to Eric Topol, whom I respect a great deal, who writes in our space and is very highly regarded, and he said, Kevin, there's a gap. You should write your book and you should focus it on normal, everyday people and share with them how what they have in their pockets, right, their smartphones, can better connect them with clinicians, nutritionists, fitness instructors, whether you're managing a chronic condition or just trying to be the best version of you that you could possibly be, how you can use your smartphone to connect to the resources that can help you get there. Mm-hmm. So that's kind of what drove me to write the book. We interviewed 30 of HealthCare's top thought leaders. We captured and we're in the process of sharing their perspective and insight, and we're on track to hit about 100,000 in sales, which just shocks me because it's my first book and it's about healthcare. And I didn't think anybody would really be interested, and I was wrong about that. I think normal people are saying, yeah, that's pretty interesting. We want to know how to connect.
Okay, so what surprised you during your research?
I think a couple of things. One is how disconnected and disjointed and how complex healthcare can be, and how stubborn some of the innovators were with just not accepting status quo, looking at complex problems and recognizing we can fix this, and I know exactly how to do it. So it was very cool consulting in that space for about 8 years, and even more fun and more interesting writing about the people who were making a difference. I think that was one surprise. I think the other surprise was when you're in the industry, you sort of have this, box seat view into what's going on that the normal population just doesn't enjoy that view, right? So I think the thing that shocked me most was just how disconnected average, ordinary people were with all the things that they have now at their disposal, whether you're a Walgreens customer or an Anthem customer or you name it, right? There's a ton of things that they're offering you that you probably don't know about.
Right. I mean, there are apps being developed every moment.
It's amazing. And the funny thing about what we're figuring out about the technology side of healthcare is apps are really just the engagement layer, right? I mean, if you look back to 8-9 years ago, I had a consumer health scoring company that I helped start, and the big pushback that we got back then was people aren't going to use this. No way will they engage, or nor will they sustain their engagement. And you know what? We got a lot of that wrong. I think people do want to be healthy. We've just never really given them tools that were this easy to use, and the apps on the smartphone kind of solved the most vexing of problems for us. But now you connect that to all the analytics engines and all the platforms that the data that we're collecting on our phones go to, and this is where things really take off and get very interesting very fast. Maria Filipova is the SVP of Innovation at Anthem, and they are building a platform that is AI driven and is collecting data from multiple sources. They're kind of, well, I don't want to say agnostic about where the data comes from, because they are developing a curated experience for their members, but they collect the data, and the point is they make it actionable. they try to understand it and then reconnect you with something else in their value chain that can help you become just a better version of you and be the healthiest that you can be.
So what's the guidance that you provide in your book on how people can better connect to all the resources? There's no shortage of that.
No, there isn't.
So what should people look out for, or what should they pursue with all of these resources available?
You know, I think the smartest thing I can tell people and encourage people to do is develop some routines and then track what you do. There's some great ways to do that that are absolutely seamless. Like I use a health scoring app. It's based out of Europe, and it's really my old company, and I'm not here to give it a plug, but I use that because I can track about 105 different things using the technology that I already have in my phone. If I go for a walk, if I walk from here to Fenway Park, that's a quarter of a mile, and it tracks and it says, hey, you did that at sea level, you did it at 5 miles per hour, you burned this many calories, you took this many steps. And I think over time what that does is it gives you some perspective on what are the things that I'm doing that are working, and what are the things that I'm doing that I think are working that aren't working. And when you connect that with people who can understand data better than you, wow, it really gets interesting. And a case in point is One Medical is my primary care medical provider. And I step on my scales and I take my blood pressure every morning. And when I went in to see my doctor, he took a look at my readings and he said, wow, Kevin, you are a consistent 123/78 kind of guy. And last December, your blood pressure for 2 weeks was up at 165/105. What happened? What were you doing? And you know, the long and short of it is I was taking some fat burning pills and I was trying to lose some weight for a destination wedding, right? I mean, I watched my wife and her sister doing it. They look great in their bikinis. Well, guys like to look good in their bathing suits too, right?
Okay.
So I did that, and I had no appreciation for the dangers for a man my age doing that. I mean, every man in my family died before they were 70 of heart failure and heart attacks, and here I was inviting, you know, that condition in, and at my age, it's just not a good way to manage your weight. So when you take a look at that from a technology perspective, you realize, you know, my doctor was collecting data on me the entire time with my permission. And when my readings went dangerously into a different, you know, into an area that just wasn't healthy for a guy like me, they reached out and they said, can we talk? Maybe you should come in, and we know that you're not scheduled for your physical for another 6 months, but we're noticing something and we would like to talk with you about that. I think that that's making data actionable. I talk about the 3 waves of digital health, and you know, one was disproving the myth that we won't engage. We will, right? I think, you know, that was one, and I think the second one was the big explosion of data around devices, and I think we call that the quantified self part of healthcare. And I think the third one is what we're on the cusp of right now, and that's connected health, where I think the new norm will be collecting data on ourselves, and then reconnecting that data with respect to healthcare anyways, with the stakeholders who can help keep us healthy. And sometimes that's a clinician, sometimes that's a doctor, heck, sometimes that's a fitness instructor, and increasingly it's going to be a nutritionist as well. But I think if we can make it seamless, frictionless, easy to use, and we don't become slaves to the technology, we can benefit from it.
What are some of the things that you like hearing at this meeting this year?
Well, this year there's a lot of innovation going on in there, and I think Ferris and Richard have done a great job of pulling in thought leaders from across the value chain. You know, healthcare, surprise, surprise, is just broken everywhere. And what you find at conferences like this are people who don't accept that. They say, all right, be that as it may, we are the team that needs to lead the disruption and the change. So you meet innovators like Aron Afek at Vim, Ray Costantini at Bright MD, you meet Maria Filipova from Anthem, and you meet guys like Abner Mason from Consejo Sano, a wonderful organization that's a not-for-profit and focused on making sure that these technologies aren't slipping through the cracks, or I should say, the people most in need but least able to afford healthcare services don't miss out on all this stuff. So it's a wonderful chance to connect with guys like Abner and Consejo Sano, and they're just a couple of examples. I think the guys from Solero are equally interesting. They have a diabetes management solution. And when you start getting into what they do and how they do it, you realize a couple of things. It's pretty easy to use, right? And they're adding so much value to your life by analyzing all this data that, in yesteryear would have been very difficult to even collect and track. So now they're making it easier to understand, and they're surrounding it with content that can help you. Like if you're a diabetic, for example, and your readings are trending in the wrong direction, this is a solution that can step in and say, maybe we need to try a diet change, right? So how do you know if you don't get some help, right? And I think that's cool.
Did you take a look at the top 10, the HCEG top 10?
I do, and I like to track that. That's one of the things that I find fascinating about HCEG is they really capture the things that are most pressing and top of mind for us as industry experts. And he does a great job of that. I always look at where some of them are trending up or down, and of course analytics are coming up because platforms are on the rise.
Do you think anything's missing on the list?
That's an interesting question. I'm not sure. I think analytics and AI, I didn't see AI specifically on the list. So I guess yes. But I think if you generously lump that in with analytics and what we're doing with the data, although I don't really think that you can, I have a feeling AI will be on the list for 2019 going into 2020.
Okay. Kevin Pereau, is there anything I've missed that you'd like to add?
No, I really had a wonderful time here today. I think the HCEG is a wonderful organization, and I really appreciate them for buying my book and giving it to everybody at the conference.
That is a good friend.
Yeah, that is a good friend to have.
Thank you so much, Kevin.
Thank you, Mabel.
Thank you.